I'm Dr. Ameetkumar Oswal, Consultant Interventional Cardiologist at Trustwell Hospital, Bangalore. Heart failure is a very common condition which a cardiologist will be seeing in his daily practice. Symptoms a patient will come with an heart failure. So one, shortness of breath or tiredness on walking or doing any kind of activities, and even at rest sometimes, or swelling in the legs or abdominal distension, and sometimes even on lying down you can have breathlessness or sometimes choking sensation. These are all symptoms of heart failure. Sometimes you may come acutely with heart failure symptoms which have just started within few hours in a time, and you may end up in an emergency room. So that is an acute heart failure which needs immediate attention, and you should not deny these symptoms and delay the hospital visit. And there are some patients who have chronic heart failure where the symptoms may go on for months together before even getting a diagnosis. Most common causes a patient who has blockage issues like coronary artery disease or a valvular heart disease, and sometimes even cardiomyopathy. The most common reasons in a day-to-day practice is even anemia, where hemoglobin is less than 10. Those patients also can come with heart failure episodes. Your doctor will make an history and an examination on which he will have a suspicion of an heart failure, and then some investigations like ECG, echocardiogram, and blood tests like BNP or NT-proBNP, which will help in diagnosing the heart failure. Then the supportive other examinations has to be done to make a diagnosis confirm for heart failure. Medications are the first line of treatment, and with medications, majority of the patients will do well. When medications does not help, then there are invasive approaches which needs to be done, like coronary angiogram in case of angioplasty is required, or a bypass surgery, or a valvular heart disease patient will need a valve replacement, or sometimes devices like an ICD or a pacemaker are necessary to prevent these heart failure symptoms and admissions in future. Most of these chronic cardiac disease patients are ending up with heart failure symptoms and signs as the days and months and years progresses. And this is the end stage of any cardiac problem, the heart failure. So hence, when you are diagnosed with any cardiac issues, make sure you do a regular follow-up and get regular treatment so you don't end up with heart failure symptoms or signs. Thank you.